I hope all of you have enjoyed this, the 9th annual meeting of the Clinton Global Initiative, and that you've taken full advantage of the resources, the ideas, and the girls who are here today to help inform and advance our collective work. I'm pretty sure that you have. In fact, this year alone, we collectively have made and announced 158 commitments to action, with a total value of close to $10.8 billion when fully implemented. The commitments that you've created and heard about, even this morning and this afternoon, when fully implemented, will have a positive impact on the lives of more than 22 million people in a variety of ways, including reducing carbon dioxide emissions by nearly 27 million metric tons, helping 11.5 million children access new and improved educational opportunities, and one of my favorites, providing more than 3 million people with access to clean water and sanitation. I think that deserves a round of applause. One of the things that I'm particularly proud of are the commitments that emerge during the annual meeting, are the commitments that expand during the annual meeting, and that we are able to provide a platform to young people like those we just heard from and the next young man we're about to hear from. And I thought that we would close the programmatic part of CGI this year, and thankfully my parents agreed, by hearing young people and some not so young people talk about why CGI and CGI University have been so important to helping imagine, codify, and advance their work. So I'm going to call on a few people, and don't worry, it's not the Socratic method. They all agreed to this beforehand. And we're going to start with someone whom I met about 6 months ago. I met him when he was 15. He informed me last night he's now 16. So thankfully he corrected that for me. I remember when I was 16, I definitely didn't want to be 15 any longer. Kelvin Doe is a testament to optimism. And we're big fans of optimism in our family, if you haven't caught on. And I particularly have a disdain for cynicism because I think it's generally the refuge of those who want to protect the status quo. Kelvin Doe's life is nothing but a repudiation of the status quo. And yesterday, I got to introduce him to some people whom I hope will help advance his work in Sierra Leone. So Kelvin, will you stand up and tell us a little bit about who you are as DJ Focus, what you have done, and how you're going to do even more?
Hi, everyone. Chelsea, I would like to ask a question. Do I look good in a suit?
You look great in a suit, Kelvin.
I thought I look like you're 50 years old.
Yeah? Don't worry, no one thinks you're 50.
Okay. I'm happy to be here. My name is Kelvin Doe. People normally call me DJ Focus. I was born on the 26th October, 1996. And basically, I am a proud Sierra Leonean. I was grown up in a community where people depend on another people, if I would say. But basically, there was a particular problem that was affecting my community. And I was so passionate to solve it, which was lack of transferring information from one community to another. And sometimes, whenever they want to transfer information, they use a local microphone, they move from one area to another. And I was so passionate to solve it. And then, by then I was 11 years old. I was in primary school, and you call it middle school in the state. Normally, after school, I used to go to trash areas and find scrap parts that I need. And mostly, once I got the part that I want, I will go to bed at around 7 p.m. And I will wake up after midnight when everybody was asleep. My mom will wake up most nights to see our living room transform into a small electronic junkyard. And she will think that I'm crazy, though she was just concerned for my well-being. But after I realized that with scrap, I could still make things work, I started fixing radios for people in my community for free. And I became a radio mechanic in my community. So whenever people have problems, they wanted me to fix their radio, they would give me like little cent and I will fix the radio for them. But one day, an old man gave me a radio to fix. I repeatedly failed to fix the radio. The old man got so annoyed and he even wanted to beat me up. I went to my elder brother's house to hide. And basically, I made my own FM radio station because my community needed it. People in my community listen to my radio station religiously. And secondly, I thought about what should I solve in my community too. And then I decided to make my own battery for people in my community. And then after my TEDx speech, and then I met with Chelsea, and you have to introduce me with some people. I have to took part in a national innovation competition that Mr. David organized, and I was one of the finalists. I had to went for the World Maker Fair in New York, and I won the Editor Choice Award. And I was at MIT as a visiting practitioner, lecturing undergrads at Harvard University. I'm recently the president of Sierra Leone. His Excellency Dr. Anas Baikroma just gave me a presidential award for the good work that I'm doing in my country, Sierra Leone, which I'm proud of. And I'm now working on solar panels for the schools in Sierra Leone. There is this company that wanted to give free internet to the schools, and I decided to give electricity to the schools. So I just wanted to say big thanks to CIG. CGI, I'm sorry. I'm greatly honored to be here. Thanks to President Clinton, Chelsea, I'm honored. Thanks.
Thank you, Calvin. Well, thank you, Calvin. Your story not only is a great testament to optimism, I think it's another example for those of us that are significantly older than you, as I am. In addition to the orchestra and the young girls that we heard from earlier than you, that we have a lot to live up to. Now I'd like to introduce you to another remarkable young person who is a CGI University commitment maker. I had the privilege of announcing her commitment at CGI University this past April. Amanda Dominguez is part of the SafeMat team from Rice University. She committed to reducing maternal mortality by developing a low-cost and easy-to-use tool that she'll tell you about. Amanda, please stand up, share your commitment. She entered into the pitch competition earlier today, so she's had some practice. And please tell us how being at the annual meeting this year has helped advance and boost your work.
Hi, everyone. Hi, everyone. Just a little backstory first, because I think it's just kind of a testament to the amazing things that CGI University and now CGI can really do for young people like myself. I just graduated from Rice in this May, 2013, and I'm now on a Fulbright scholarship in Spain, so long plane flight back tonight. But 4 years ago, I was the first person in my family, an immigrant family from Central America, who left Central America in a time of turmoil during the Sandinista Revolution to come to America because my mother wanted to give all of her children, all of her girls, the American dream. So 4 years ago, I started at Rice University, and I took a class called Introduction to Global Health Technologies because I thought it sounded pretty cool. 4 years later, I am positively and 100% certain that global health technologies is what I want to do with my life. As a part of this class, this Global Health Technologies minor, we had group-based projects that were focused on solving the world's biggest problems. The first one was called the Dose Right. It was part of a group that had two other amazing girls, amazing women now in the politics field around the world. It's called the Dose Right. And I don't know, President Clinton, if you remember announcing me, 2011, San Diego, that started everything. It's essentially a small plastic clip that prevents overdosing an oral liquid medication when using a syringe. It was made for pediatric AIDS patients. So if you are a child born to an HIV-positive mother, you obviously can't take pills or the pill cocktails that most people with HIV have, so you have oral medication. And the parents and the mothers who are also taking their own HIV medication are responsible for giving that to their children, and there's a huge problem with misdosing. So 2011, I was announced by the wonderful President Clinton, and that kind of started it all. It was a catalyst. I learned so much from that conference. I was inspired, I was motivated, I was driven, so that 2 years later, 2013, fast forward to this April, I applied with another project, one that I did not invent, like the Dose Right, but that I have been on the development team for a while now. It's called the Safe Mat, and Chelsea wanted me to show it to everyone. It's a mat that diagnoses postpartum hemorrhaging. Each square has a chemical in it, same chemical used in diapers. And each square absorbs 50 milliliters of blood, so that when fully saturated, each square, the healthcare providers only have to count each square and multiply by 50, and they know exactly how much blood is lost. Postpartum hemorrhage, I know some of you know, is the #1 killer of women, #1 cause of maternal mortality around the world. 99% of these deaths occur in the developing world. So this mat is made, it's very low cost, it's very simple, it's made for use in low resource settings, but can also be used in places like the US. As a result of CGIU 2011, and then Chelsea being enamored with the Safe Mat, I am now here among all of you amazing people, some of the most influential people in the country. And I am humbled and I am inspired. And it's these kinds of things, these CGIU that is just bringing young people to the forefront. We are the next generation. We are the next generation of scientists, of doctors, of innovators, of politicians. Our commitments and our projects also need to be showcased in addition to all of the wonderful things you're doing. And I commend CGIU for doing that and for focusing on small group projects like this that I did in 2 of my classes in my undergrad minor at Rice University. And Rice has been an amazing partner, and now CGI as well. And you are a huge catalyst on just making these projects successful, because now they have moved from the small projects from a classroom, and now the Dose Right has been disseminated to over 200,000 people in Swaziland with the help of the Clinton Health Access Initiative. And hopefully the same will be with the Safe Mat as well. So just thank you so much for the opportunity, and thank you. I hope to come back.
Thank you, Amanda. Another example to live up to. And as you've seen throughout the meeting, beyond trying to ensure that more of you get to meet more young people like Amanda, we also increasingly, as my father said at the beginning of the annual meeting, have been trying to highlight progress reports to help celebrate people who not only have kept their commitment, but often have expanded their commitment. And so to hear a story in that vein, I'd like to ask Gary Barker to stand up. Gary is from Promundo, an organization that, along with its partners, made a commitment in 2011 to launch MinCare. Gary, will you please tell us a little bit about your commitment and a little bit about how it's progressed and how it's changed?
Sure. Thanks very much, Chelsea. I'm feeling like an underachiever as the not-so-young person in this group here. Very impressed with these stories. Thank you. Yes, thanks. We launched MinCare in 2011, looking at the issue that across the world we were hearing that women are not achieving their full potential in terms of economically, politically. They weren't able to access the life-saving medication they often need around maternal health. They're not able to achieve the full lives that they deserve because of violence by men. And figuring out, how do we engage men as fathers? 80% of the world's men will be biological fathers at some point. And we said that there's a tremendous opportunity to reach out to men as fathers. So MinCare looks to engage men as equitable, nonviolent partners in childbearing and child rearing and doing the care work, not just the fun stuff, but the dirty work too. And we see examples like the bishop here and many others in this room that men can do this work, contrary to popular belief. Men can care for young children. And the secret to it is we're finding it brings benefits to women's lives, to children's lives, and men's lives themselves. We're thrilled that it's now active in 25 countries. And perhaps the most thrilling part is 4 ministries of health have taken it on, seeing that if we engage men in the prenatal period, we've got a chance to engage them lifelong, so they're including as part of their prenatal work, recruiting fathers to come be part of that visit. We have a chance to screen for violence. We've got a chance to offer services when violence is going on in the family, have a chance to engage men in learning how to be better fathers and caregivers, and they don't complain. They're not seeing it as a bitter pill. In fact, they're seeing the benefits to themselves. And if I recall yesterday, I heard President Clinton say that he was a Lamaze father, so I'm expecting him to be one of our trainers, and he can choose the country he wants to come to. So we're thrilled. CGI has been a fantastic opportunity just as a voice around women and girls and a space to say we see the need for men and boys to be part of this, to fully embrace the equality that comes, and that men's lives get better as we embrace the full empowerment of our daughters and sisters and partners. So thanks for the shout out, and I'm very impressed with the young people who came before me. This is the kind of change that we're trying to make happen. Thanks.
Thank you, Gary. As I frequently find myself saying, I'm deeply unapologetically biased towards my parents, and I hope that every father can be as great as my dad. Oh, thanks. Shameless. One of the things that I think makes commitments like Gary's or Amanda's so exciting is that they are able to find partners here at CGI. And really, we hope that catalyzing of partnerships isn't something that just happens during the annual meeting, but happens throughout the year and hopefully happens well beyond what happens in the Sheraton, even if people take their first crawl here. And so to talk a little bit about the importance of partnerships and of always being open to new partnerships, I'd like to ask Cameron Sinclair from Architecture for Humanity to stand up and tell us a little bit about the partnerships he's developed at this year's CGI.
Thanks, Josie. Hi, my name's Cameron Sinclair. I've been focused on the issue of Syria. I know it hasn't come up much in this conference, but our leaders, and particularly the media, has focused this as a political crisis. But actually, it's a people crisis. And in particular, we now have over 2 million people that have streamed out of Syria in desperate need of shelter. We started to look at safe spaces for mainly women and girls within the refugee camps. And at CGI, we met with Pelosio, which is a construction company. We had a meeting with Malala. And thankfully, President Clinton met with King Abdullah, and his court came and met with us and talked about the need of expanding this into creating deployable centers of excellence that can be places where kids can get education, there can be health, and really entrepreneurial centers for these refugees. The average lifespan of a refugee camp is 9 years. So to understand with 75% of the refugees, both women and children, that we need to focus on this. So what we're hoping is by CGI International in Rio that we have a firm commitment that we can get going.
Great. Thank you, Cameron. And finally, I'd like to ask Sanya Nishtar with Heartfile to stand up. And I hope that she'll talk a little bit about how her commitment has evolved throughout the year. And I hope that she'll also talk a little bit about kind of how we've tried to respond to what she's asked us to do to help support what she knows she needs.
Well, thank you very much, Elsie. As you're aware, our commitment is focused on protecting people from foregoing health care when they can't afford it or becoming impoverished and indebted in the process of seeking health care. Millions of people in the developing world just cannot afford health care. There are women, poor women, who are taken away on the bed from hospitals, bedridden for life, just because families cannot afford to get their hips fixed. Their children with congenital heart disease live to adulthood with conditions which are totally correctable just because their parents don't have the money to pay for operations. So in 2007, at the CGI Asia, we launched a commitment which was focused on creating a mobile phone-based technology platform which could enable access of such poor people to direly needed money for operations, life-saving operations. And as we've scaled up this program in Pakistan and developed it, CGI was enormously helpful in finding us the partners. When we subsequently developed something which we thought could be of use to other countries with similar health systems in Africa in particular, CGI helped us find partners who could scale it up in several different countries simultaneously and connected us with Management Sciences for Health. As we continued to scale up this program in Pakistan, we were finding that it was becoming extremely expensive because these are high-cost operations that we were supporting. So this year, CGI linked us up with an organization called Direct Relief International. That organization channels medical donations to developing countries. And by deploying that arm in the program, our costs are going to be considerably minimized. And as planning is now underway to develop and diversify this program into many different directions, it's an innovative tool to protect poor people from healthcare expenditures, and as more broadly as a financing tool for universal health coverage, CGI is helping us bring partners to the table, and we look forward to continuing and deepening this relationship. So thank you very much for being there with us.
Thank you.